after a while, another nurse brings her up. And I was like, oh, what's wrong? And then I smelled it. I smelled what was wrong. So basically, coming upstairs, she left a trail of poop behind her. Welcome to another episode of Pregopod. This episode is going to be a little bit different. First of all, I'm speaking English, and it's going to be about my experience working as a midwife in Pakistan. But first of all, I have a guest with me today. Would you like to introduce yourself?
Hello, I'm Petra. I come from Sweden, where I met Attika about 12 years ago, and today I'm just an unexperienced guest listening in on your stories.
Yeah, you don't have a lot to do with midwifery or pregnancy or children, but
No, I don't have children, but I'm very interested in the subject, and it's very interesting to hear all about
yeah,
what you learn.
what I do have to say is you're the best listener ever, so I couldn't have chosen anyone better.
Great,
So,
I'll just sit here quietly through the
in the
whole
corner.
episode. Yeah.
Well, most probably, because I'm gonna be talking nonstop, I think. First of all, let me just say, like, ever since I was very young, I wanted to do volunteer work. I don't know why, but I've been so interested to go to like poorer countries, Africa. I had a huge dream of going to Ghana like the last year that that you also get the opportunity from the school to try and yeah go to other countries, just see how the midwives work there. So I was so interested to go to Ghana, partly because my husband is born there and I wanted to see his history, um
Mm.
so so yeah, the almost the day I got my certificate, like you're a midwife now, you can use this. I also applied for a volunteership, um and that to Pakistan. So it all worked out, and I was like, I had been so sad, I know, the months before, and like looking forward to this trip. Just I was so happy. I was so happy, but
Mm.
also excited and scared, and everything in between.
Yeah, you were very excited.
Yeah, I was very happy. Like I was collecting baby clothes, and I was collecting lotions and medications. I was very excited to be able to go there and just help out. But also, like, I have to be honest, it wasn't like, oh, I'm such a good person, so I want to go there helping people. No, it was also like a selfish cause. I love doing the work. So yeah, I couldn't almost believe that my dream would come true. And this is like a really small town. Um, so I'm not gonna say exactly which hospital it is, because they have been experiencing a lot of security issues, and I'm going to be talking a little bit about the facilities there. So I'm not going to say exactly where it is, but it was the best team ever. Like, obviously, there are good doctors and bad doctors everywhere. You have the good nurses and you have the bad nurses, but overall, this was an amazing team, and they were so competent, and I just loved working there. So, well, the first few days, um,
Uh,
yeah.
What kind of hospital was it, and what kind of was it for a birth center or?
Well, it was a proper hospital. And so the unit I was working in was a labor ward.
Okay.
Um, but they also had like an emergency area, and then there it was evaluated if you were to go into the labor ward and then into the delivery ward. So I was working these three units. I was working the emergency ward, the labor ward, and the delivery ward. So that's how it was kind of set up. But so if you work here in Belgium, for instance, or in Sweden, if you are in that particular area, you're only going to see pregnant women from, I think week 20 up. Like from the point that the baby is viable, you're going to see those pregnant women. But we saw everything. I mean, I like things that I couldn't even imagine. Like obviously pregnancy related stuff, like people having miscarriage, self-attempted abortions was also like a common thing that really surprised me, because this was a really like religious place as well. What we could also see, unfortunately, I saw rape cases. So everything that had to do with the female, I was gonna say vagina, but that's not what I meant. Like everything that had to do with the female reproductive organ, you would see there.
Okay.
So it was a really like a mix of different people, but also like you would have, because the emergency area was just one big room. So comparing, like here in Belgium, if you're going into labor, for example, you're gonna be led into a hallway and you're gonna be entering a room, and maybe you have a bathtub there and you can put your baggages in the appropriate place, like in the wardrobes, and you put your baby's clothes up there. In Pakistan, you enter this room and there are 4 beds, and for privacy you have these curtains drawn, so you only have the curtains to separate you from the other patients. So there's a lack of privacy, and there is a common toilet, and but we did everything, and the team did everything to make that comfortable as well. So it was a really good unit. So there would be an evaluation at that point, like seeing if you're actually in labor. If you go into the labor ward, you're laboring with other patients. And it's very, very different. And obviously, like one of the biggest differences for the patients, like here, you're always, I'm not going to say always, but you have the option of getting an epidural or asking for an epidural. Obviously, like if you have some sort of defect in your spine, or your platelets are too low, then you're not going to be allowed to have an epidural. And I love those cases, like working here in Belgium. I just loved working with women that didn't have any kind of pain relief, because I was kind of their only source of pain relief, because a midwife's words and her actions, like massaging or just supporting, that can also mean a lot, and that is a sort of pain relief. So I remember like
you have to work in a different way.
Definitely. And I remember like my like the students that I work with were always like, oh, but it's so much easier once they have an epidural. And that's true. Like you don't have to hear them screaming, and they're comfortable. But I always felt like I had so much more to do if they didn't have an epidural. So for me, this was like utopia, like all these women in pain, and I was like, yes, I'm here for you.
Sounds great.
Yes. I'm a bit of a sadist in that way. But
you really have to bring out the best in yourself to be able to help these women. So you have to work on a whole new level.
On the other hand, like if the midwife's busy and you have these other patients, you can't be like pampering one of 4 patients and being like, oh, I'm gonna come here, I'm gonna massage you. And so you have to have a balance between the patients as well. and obviously like I got to see a lot of different things there that I wouldn't be like here. I would never see that. For example, we had a premature birth in a breech position. We had like
Mm.
that thing is just like I've
What would you do in Belgium for that
well,
kind of case?
here I would never do the birth. I would be pushed aside
No.
and the specialist would come in and probably like
Oh
if they
yeah.
knew that
Okay.
like it's a preterm birth, they would do a C-section.
A C-section.
Yeah, so it's
Yeah.
definitely like uh going in very quickly. Whereas there, they didn't have an option to even transfer this woman. So, and that was actually the first baby that I got to reanimate as well. So it was,
What does that mean?
well, that, yeah, it means like the baby came out white. And like my teachers always said, a blue baby is better than a white baby. So when you see a blue baby, normal people, they're like, oh no, it's blue, it's deoxygenated and it's not going to survive or it's
Mm-hmm.
in trouble. But whereas a blue baby is going to start breathing and kind of pink up in most cases, and a white baby comes out, it hasn't had oxygenated blood for quite some time. So
Oh.
we did this breech delivery, and actually I was assisting. So another midwife did the delivery, and I grabbed the baby. It sounds like I grabbed him by the foot or something and ran, but I properly like took care of the baby and
Yeah.
ran out the room. No, I walked like in a nice pace without dropping the
Calmly.
baby. Well,
Mm-hmm.
I don't want to give the impression that I'm a really like yeah, a floozy kind of midwife, but
No, you're
no,
not.
I was
You're
very,
very thorough.
yes, I
Yes.
was being
Mm-hmm.
very careful with the baby. So we
Of course.
put her in the, so it was a female, and she was, I think she weighed like at about 1.9 kilos, a really thin
Oh,
baby.
that's
She
tiny.
didn't have a lot of, yeah, that's really, really tiny. So we actually, at this unit, we didn't have a mask that was as tiny as she was. So I asked for
Oh.
assistance. So another midwife came, and she was like looking through the material to find a smaller, like a premature sized a mouth cap. So it was like, yeah, it was very difficult to get this baby to get to breathe again. But after 1 or 2 minutes, we never got to the point where we had to give heart massage. So it was just the inflations and giving a little bit of oxygen. And after a minute, she started to move a little bit and like make a little bit of sounds. And you know, at that point, that's just the
Hmm.
most amazing thing you've ever heard.
Yeah, I can't imagine working on a baby that little
Yeah, yeah,
in that kind of situation.
it was definitely like, I can't say I was scared at that point. I was really happy that I could do something. But I've always
Yeah.
imagined it to be a really scary situation. But at that point,
Yeah, that was
yeah,
what I was gonna ask
yeah.
if it was scary at
It
all.
wasn't like afterwards, I was like, wow, I did everything right. Like afterwards, you can think about stuff that you could have done better. But I was like, no, I took the temperature, I took the saturation, I gave oxygen. I was like, I didn't miss a step. I'm such a good person. So no, I was really, really happy about myself at that point. But also like an experience richer. So I remember this particular day I had the the evening shift. So I came in, um, yeah, I came in quite a bit late, and it was a really hectic morning. So normally what happens is you get a briefing, you get information about all of the patients, and you see all the patients together with the other midwives. But this day, no one was available, and me like waiting for 5 minutes, I think tops 10 minutes, I was like, I can't. Like obviously they're busy, they're gonna want to have help. So I just randomly entered a delivery room, and I immediately it struck me that everything is not okay in here. So something has happened,
Oh.
and I don't know exactly what caused that feeling, but I was like, something's not right. So the baby was already delivered and wrapped up in white sheets and put to the side. Normally, you would never, like, the baby wouldn't lie there alone ever. It's always like someone
No.
is grabbing it or taking it to the baby room or something like that. So, and then the midwife doing the afterbirth, which is like the placenta is coming out and stuff. I saw her face, even though she had like a mask on and I could only see her eyes. And she was like, can you take care of the baby? And I was like, of course. And then I saw the mother, and there was no smile. There was, well, almost like there wasn't any kind of facial expression at all. So I just took the baby. I didn't even introduce myself. Like normally, when you go into a room, you have like the new shift always introduce themselves. But I just realized this is not the moment. So I took the baby and I realized, okay, so it's a stillborn. Also a female
Mm.
baby, like she had passed away a few, I think tops a week before that. And the mother had come in for a checkup and realized that there was no heartbeat, which is really like heartbreaking trauma in itself.
Yeah.
So that was the first time that I cleaned a baby that was passed away, and you had to be really careful. I'm sorry for details, but you have to be really careful with their skin and
Mm-hmm.
and obviously, like you want to do it right. You want to clean it up for the family and for the
Yeah.
mom. So after we finished, like as I said, this was a hectic day. It was really baby boom in our ward. So another patient came in into the next room. Um, and the thing is, this was not ideal because these particular rooms, there was like a hallway in between these two rooms, and without doors. So what would happen in
Mm.
delivery room 2 would be heard in the third room. So we I was really I was really adamant about shifting the other mother, because even though it's a stillborn, she's still a mother. Um, I was adamant about moving her as quickly as possible to another ward, to another room, to another corner. I was really, really like, I told the midwives again and again, like, have you shifted her yet? No, she's cleaning up. And I realized that, but it had gone like an hour, and it was about time that she was moved. So then I went to the other room with the other mother, and as I said, there's no pain relief. You only have the words of the midwife. So normally what I would say in that situation is like, come on, little pushes, and you're gonna get there, and soon you'll be able to hear your baby cry. And I
Mm.
couldn't say those words. I couldn't say it
No.
because I realized that there's another mother sitting in this room, um, hearing me tell her that, and
Yeah.
she herself hasn't been able to experience that. So that's such a emotional trauma on top of everything else. um so while she's pushing, like the contraction was gone, I went out again, like totally sterile dressed, and everything's like my hands are clean and everything, but I had to go out again. I was like, can you please shift her to the other room? And this is like the first, like, I'm a very polite person. I always talk with a lot of respect, but at that moment I was like, can you please go and move her from this room? And they were like, we're on it.
Mm-hmm.
Because I couldn't imagine her laying there and hearing this other baby being born and hearing its cry for the first time.
Yeah.
So anyway, so I went back into the labor ward and I was able to focus, and the baby was born and it cried at once, and I was really happy. It was such a nice birth. She didn't need any stitches. It was just an amazing birth, and I was so happy for that mother. But when I was going out, I saw the first patient being rolled out of her room. And I don't even remember if we had eye contact at that moment. I don't think we did. I don't know if she wouldn't look at me or I wouldn't look at her. Like, I don't remember that at all, but like I was feeling her pain at that moment.
Yeah.
And yeah, that was the most disappointing part of the whole experience.
Yeah. I feel like that's such an unimaginable pain. Also to be around, but like you can't understand what she's going
No.
through. And I'm wondering, like, how do you switch your mindset going between these births, like going from the first mother and then straight into the second mother's delivery?
I think normally I wouldn't have a problem with that. Like, normally if she was to be in another room, I wouldn't or in another part of the unit, I wouldn't have a problem with that. But
Mm.
as I was caring for this new patient, I was thinking like my mentally I wasn't there, and I couldn't do a proper job. Like, I wanted to support her so bad, but I couldn't get those words out. So
Mm.
at that moment, I don't know if I failed as a um, as a supporter or as a midwife, but I couldn't get through that. Um, yeah, because I just wasn't there mentally. Always taking the history of a patient. If a person tells me, "Oh,
Mm.
I've been bleeding for 10 days and it won't stop. I think I was pregnant." And but it doesn't, like, it's not stopping. I'm gonna be like, oh, maybe you're having a miscarriage. But whereas this other midwife, this older, more experienced midwife would be like, I think she's attempted an abortion at home. So, and she would know these things. I was like, no, you can't suspect people of doing that, and you can't like talk to that. Like, I wouldn't be able to talk
Oh.
to a patient and suggest that she had done anything like that, but she would be right 10 out of 10 times. Yeah, so these are really, really experienced midwives, and they're doing a really, really good job.
Because I'm assuming this is a situation she would meet a lot more than, for example, you would meet in a unit in Belgium. Do you learn in school about how to handle attempted abortions?
It's not like those situations don't occur in Belgium, where patients are being dishonest. But attempting an abortion themselves at home I've never experienced that in Belgium. But for instance, I was at this hospital, and again, I was with the supervising midwife, but I was taking the history of the patient. So she had her daughter that was around 10 years old. And I went up to this mom and I was like, so this is your second pregnancy? And she's like, yep. And I was like, okay. And I like asked her all the questions, and we came out. And this supervising midwife, she was like, this is not her first pregnancy. This is not her second pregnancy. I was like,
Mm.
how can you say that? I like,
Mm-hmm.
she told you, and she was like, you have to ask her again when the daughter isn't there. Um,
Oh.
yeah, and I was like, well, uh, but how are you suspecting this? She's like, didn't you see her tattoos on her forearm? So she had three different names and the birth dates of after those names. And she was like, who does that if not for their own children? And
Wow, she's like a detective.
yeah, she's like a super midwife. And I was like, no, that could be her pets or her dogs, or people do weird
Mm-hmm.
stuff. And I was like,
Yeah.
but so as soon as the her daughter left, I went into the room and I asked her, so you're sure this is your second pregnancy? Like you haven't had miscarriages or any abortions? And then eventually she told me, she was like, yeah, this is not. So this midwife, they have an intuition, first of all, but they have these detective eyes, and those midwives aren't only in Pakistan or only here in Belgium. Like they're everywhere, and it comes with
Mm-hmm.
experience. It comes with working for several years. So I'm like, I get super impressed with these
Mm-hmm.
people.
Yeah.
And yeah, and I wonder, am I ever gonna be that good of a midwife? And I hope so. I hope so someday.
Do you have any other experiences from the trip that stick out?
Okay, so this is a story like I've thought about it several times since coming back, and I'm like I laugh my ass off. I laugh my butt off every time. So I had this patient, like this is like during my first few days in this ward, and obviously like when you're new, you have to kind of prove yourself, and you have to kind of show them that you're competent. So I had to give this enema to yeah, to a lady, and she an enema is you go up the butthole and you give medication so that this gives like a little bit of this irritates the bowels, which means that like after a while she has to go to the bathroom. So I told her this is the bathroom, and so it was um I explained to her everything. This is a bathroom, and you have to hold it in for like 5 to 10 minutes, as long as you can. But most of the time, it's 5 to 10 minutes that they can hold it up, and then they have to go to the bathroom. So, explain everything, and I go to another patient. And what's important in this story is that the toilet that they had there, it was I think they call it a commode. So it's like the toilet that we have here in Belgium and Sweden. So you sit on it. But most of these women are from villages where they have a toilet in the ground. So it flushes and everything like that, but basically they're
Mm-hmm.
squatting to to be able to go to the bathroom. Um, so, but I didn't know that this would be a problem for her. So I was busy with another patient, and she went downstairs where those uh, those toilets are available, so she could squat. And after a while, another nurse brings her up, and I was like, "Oh, what's wrong?" And then I smelled it. I smelled what was wrong. So basically,
Okay.
coming upstairs, she left a trail of poop behind her. And
Oh.
yeah, so I felt so bad for this patient. I took her to the toilet, and and then my supervising midwife came, and she was like, "What is this? And what's going on?" And I was like, oh, "How am I supposed to explain this to her?" And I couldn't understand. I was like, "No, I told her," like, and I didn't want to be explaining myself in this situation. So everyone, like the patients coming in, they were like, huh, what's happening here? Like we could smell it from like far away. And I asked this patient, I was like, this is the first time that I was like kind of like I wouldn't come like instead of comforting her, like it's okay. I was like, but I told you this was the toilet, like, and she was like, Well, like I didn't get any pressure here. Like you need pressure from squatting to be able to
Mm,
go to the bathroom. And then I really understood her because I also have TMI, I have a squatty potty at home.
mm-hmm.
So I always sit with my legs up. Like if I can't go to anyone else's bathroom and do number two because I need a squatty potty. I need to
Yeah.
be able to but
But that's how we house train ourselves, right? Like people,
yeah,
we just get
yeah,
used to the exact position in which you go to the bathroom, and then you can't any other way. So yeah. Oh my god, poor lady.
yeah, poor lady. And then afterwards, I was like, no, I totally get you. Like, I need that pressure myself. But I was so worried that this supervising midwife would be like mad at me, whereas like I'm really a people pleaser, so it was a really bad but funny situation. Like looking back at it, and this patient, we we were such good friends at the end of this like because she was in labor for like 2 3 days, so at the end we were
Oh
like
wow.
really buddies. And so I
Wow.
hope she didn't mind me asking her like, what did you do? but but no, poop, you can clean it up, it's fine.
Yeah. And what a great friendship bond it creates. You were talking a bit about like in Belgium when women come in to deliver, they bring their bag, they
Yeah.
make themselves at home, they pack up a bit and make the room theirs. And I know that different countries have very different ways of doing that. I think in Sweden you have the same labor room as you deliver in, for example. And I know in many countries nearby that might not be the case, but you do have a separate like delivery room. But my unexperienced assumption is that like you try to make it a super peaceful and zen space when you go into to your labor room and so on. Like, was that the same goal in the labor rooms there? Like, do you go in and everyone tries to have it like a really zen, peaceful place to? I don't know. That's like the assumption I have about women going into labor in Sweden, at least.
Yeah, that's a really, really important part of giving birth, that you're in a secure environment. You make the room a bit darker, or you kind of dim the lights, and
Mm,
most women have their own music, and there's a place so you can play your own CDs. Um, and yeah, you really have that psychological aspect again of giving birth. That's really, really important. So um, the right parts of the brain is activated in order to help you with the right hormones and the right endorphins. So um, there, I felt like that aspect was non-existing to a part. Um, and that's why I think now everything is very medicalized. So going into this labor ward where it used to be very midwife led, so the mothers could squat and they could get into the position that they wanted to be in, and having a one-on-one connection with the midwife, having a secure person there, mm, that has become
mm,
increasingly um, yeah, now it's not existent there anymore. So you don't have that psychological aspect of making it a dark room or a safe space or anything like that. Um, and that's why I was very keen on, like, if there was only one patient in the labor ward, I would stay with her from beginning to end. I wouldn't take any pauses. Like, I have a really good urine bladder, so I don't have to go pee. I only pee like 2 times a day, which is really bad.
what a
Yeah,
superpower.
yeah, but you actually, midwife recommended go pee more often. It prevents urinary tract infection. So that's really important. But
Do as I say, not
yeah,
as I do.
exactly.
Yeah.
So, but so I would stay with this person throughout, because I think it's so important. When all the other things are lacking, you need to have a secure person with like telling you all the time. Like obviously I didn't have the other work as well. Like you have to fill out your charts, and you have to do other things that are required when you're working, properly working as a midwife.
Mm-hmm.
But to me, to just be able to sit by her, not even massage her or tell her or talk to her constantly, but just be there, I think that's the biggest support that you can have when everything else lacks.
Mm.
And
Yeah.
these women, they aren't used to going to the doctors. They aren't used to having medical care, and they're scared of getting shots, and they're scared of the internal examinations, and like even normal things would be such an anxiety for these women. So, but I'm really, really glad that I got to spend as much time with them as I did.
I was wondering about like, do you bring your partner in for delivery in this hospital?
No. So you don't have
No.
anyone. Like I think most women wouldn't even want their husbands to be there. But they would want their moms. Like they were calling out for
Mm-hmm, yeah.
their moms, and like their moms would also be right outside the delivery ward at all times, and asking us how it was and how everything was going. So I really like pity those women, not pity them, no. I feel bad for those women that have to do it, that are really uncomfortable and need like um support from someone that they know, like
Mm-hmm.
from the family, or whether that's a partner or your husband, or anyone, like someone that you know, just would make the hugest difference. So unfortunately, that wasn't allowed.
Okay. Is that like a common rule because you were there right before or a while before the whole corona time started, and I know that in Sweden when we kind of were still rising on the corona cases, it was the same for women delivering here. You weren't allowed to bring in some hospitals you weren't allowed to bring anyone in with you. So was this why weren't you allowed to bring anyone in? Was there a specific reason or?
I think I actually never asked them. Like obviously this is a like Muslim um female ward, so if we're to be able to make the midwives and the doctors feel comfortable working there, and not having to have like just being able to work as themselves, and
Mm-hmm.
being loud, and being um, able to communicate in the way that is required. That's why the husband isn't allowed. But why the mother can't be there, or any other like supporting family member, I think the reason is because they can get in the way quite a lot.
Mm-hmm.
And these are mothers that are scared themselves, and they don't trust doctors, they don't trust the midwives. Um, well, they're advocating for their women, well, their children's rights, which is a
Yeah.
really good thing, because then the women can relax and just depend on their mothers to fight the battle for them. For example, you have to lay here in bed, and she goes, "No, I want to squat on the floor." I, as a midwife, find that no problem at all. But working under gynecologists and doctors that want to cut and want to be there with their hands, and want to support the head coming out, and everything like that, it's just easier when you can silence a part of the critiquing family members, I think. But I never actually asked why are they not allowed. Yes.
I feel like that's something I learned about just a few years ago. Even if you have your partner or some other relative or so there are also, are they called doulas?
Yes.
Yeah, that can come with you and just like be your advocate and guide you through the situation, because I feel like in any kind of hospital you might end up with, I mean, it's hard enough, I believe, giving birth, and then having to fight for your decisions about how you want your birth might be, it would be better to have that responsibility lay on someone else.
Exactly, exactly. I feel the same way. Like now, if I think about going to the hospital and giving birth, I want someone that's gonna be like, well, she doesn't want this. Like, just
Mm-hmm.
read my mind. I've told you beforehand what I want and what I don't want, and you advocate for me. You fight my battles. I'm just here to push this baby out. Like, I'm just here
Mm-hmm. Yeah.
to have the best experience possible. And you, like, this is not something that I need to be thinking about. But that's why it's so important to kind of choose the person that's going to be there with you. Like, for some people, the best supporting person isn't necessarily the partner, I feel like sometimes. And also like your partner or the father to be um is also experiencing this wonderful
Mm-hmm.
thing the first time or the second time in his life, and it's not going to happen 100 times, so he's wanting to enjoy this situation as well, and therefore having a third person like a doula or someone is so,
Someone with
yeah,
experience
is so
is
important
probably, yeah.
and so nice and so relaxing. So it's unfortunate that during these corona times it's not allowed, but I've been working in hospitals here that only allow one person. So you have no
Mm-hmm.
photographer, you have no doula, you have nothing of that sort. It's just you and one other person. And
Mm.
luckily for me, when giving birth to Abir, I had my husband there, which is like just mentally very satisfying. Like he's experiencing this with me. But also, I had my
Yeah.
mom there, and she was like really practical. Like, you need to eat these grapes, and you need to get more energy. And have you been drinking water? Do you need to go to the bathroom? Like a constant reminder of things that I had told her beforehand. Like these are
Yeah.
important things. So. Yeah,
And maybe you were able to be that person for some of the women.
I think always like discussing patients is like a bit of a hard thing for me because I'm not sure, like, even if you don't know their names, you're not going to recognize any of these people or even come in contact with these people. There are still people that played a huge part in
Mm-hmm.
my life. So I don't want to be like, I don't want to
I
tell a
know.
lot of patient
Yeah.
information, but we could do another episode. Or if any of the listeners have any questions about the experience there, or any questions about how, yeah, anything, then please let me know, and we'll answer them in another episode. But this is getting too long, so I'm just gonna wrap it up right now. Hope you had a nice time listening to us, and sorry about my English, but I think we did a good job.
We did a good job.
Okay, thank you so much, Petra, and
Thank you.
I hope to see you all in an episode very soon again. Bye.
Bye.